So yes, I want to say good morning, everyone. I'm so honored to be here today and to share amongst you all. I have much respect and acknowledgement for each and every one of you. My name is Jennifer Finegold, and I'm tuning in today from Austin, Texas, which is in the United States. I am the owner of Fiery Sage Healing, and I have a private practice where I treat patients using both acupuncture and hypnotherapy. And today I wanted to share with you these modalities and how they can be very effective for healing. So stress, who doesn't have it, right? Studies have shown that stress is the cause of 95% of illness and disease. So clearly stress is a root level, a reason why many people get sick. What are some of the markers of stress? Well, I think that it can manifest in the body, mind, and emotion. In the body, it may manifest through test results such as high cortisol or glucose or high blood pressure. In the mind, it may manifest as worry, anxiety, or even OCD. Through our emotions, stress may manifest as depression or a lack of motivation. Overall, we all experience stress on some level. There is really no avoiding it. So to experience stress is inevitable. How we choose to respond is optional. And what's most helpful is to practice habits and behaviors that help to prevent and mitigate disease or illness from occurring in the first place. I think we're all very much aware of that, which is why we're in, the space that we're in. And there are many natural options to help to reduce stress. Many of us know some of those simple ones are diet, exercise, proper rest, other things such as meditation, going out in nature, massage or yoga. And hypnotherapy and acupuncture are also two great options that help to treat stress and therefore the links associated with it with different illnesses and diseases. So I will review with you what both modalities are. What is hypnosis? Hypnosis is tapping into the subconscious mind through relaxation techniques in order to induce change through the power of suggestion. Hypnosis has been around since early recorded history. It was practiced all over the world since ancient Egypt, India, and Central Asia. In the mid-1900s, the well-known psychiatrist Milton H. Erickson integrated hypnotherapy into his practice, and his patients responded very well to the power of suggestion. In 1958, both the American Medical Association and the American Psychological Association recognized hypnotherapy as a valid medical procedure. And since 1995, the National Institute of Health has recommended hypnotherapy as an option for chronic pain or psychological ailments. So it's pretty well known and integrated in many forms of healing and practice. So let's dive a little bit deeper. How does hypnotherapy work? So essentially our mind is split between the conscious and the subconscious. As you see on the picture, there is a huge iceberg. The conscious part of our mind is just the tip of it that has our conscious awareness. It operates on a beta wavelength. And the conscious part of our mind is that part of us that's the rational, linear thinker. It helps us get from point A to point B. The subconscious part of our mind is what lies beneath. It's the storehouse of our emotions, memories, habits, beliefs, and patterns. And it even controls our autonomic functions, such as breathing and our heartbeat. The subconscious operates on an alpha wavelength. So essentially, throughout the day, we're constantly operating in and out of our subconscious mind without even necessarily being aware of it. As you see here, we have the 4 different brain wavelengths. So the beta wavelength is the conscious part of our mind. It's when we're awake, we're linear thinking, we're using our rational analytical functions. The alpha wavelength is what is used to get into the hypnotic state. It's that relaxed, calm meditation sort of state. It's also similar to Vipassana or meditation. Theta is a deeper wavelength. It's kind of where you almost feel like you're sleeping. There's a part of you that's aware and a part of you that is drifting off to sleep. It is also referred to as trance, which is used in hypnotherapy. And delta, of course, is the deepest level, which is what we're in when we're asleep. So as I was saying, throughout the day, we're operating in and out of our subconscious mind without even necessarily being aware of it. A good example is when you get off of work. You may drive home, and while you're driving, you may think about what you're going to make for dinner or how your day was or whatever else may be. And you're not consciously thinking about driving home, but you still make it there. That's an example of being in a hypnotic state because it's become a habit or a pattern. So, applications for hypnosis in clinical practice. Hypnosis can be used for many things, but these are some of the main ones: weight loss, smoking cessation, fears and phobias, insomnia, self-confidence, anxiety, depression, academic sports performance, unwanted behaviors such as nail biting, hair pulling, etc., and for overall well-being and relaxation. So as you see with this list, many, if not all of these conditions have the underlying link of stress being the root cause. Many people are overweight because they stress eat. Many people smoke because they are stressed. Insomnia, you can't sleep because there's a component of stress or anxiety. Stress is very fundamental. Going back to my second slide, you can see how it creates 95% of illness or disharmony. And so this is just a simple outline of how that manifests. So we have a stress factor, which leads to a behavioral or emotional response, which can lead to disease or imbalance. So stress in life can lead to overeating or eating emotionally, for instance, and then that can manifest as obesity or diabetes. Hypnotic techniques. There's somnambulism, which is kind of like a guided meditation. It's a fancy word for getting you into a deep state by closing your eyes and doing a progressive muscle relaxation. Neuro-linguistic programming, or NLP, helps to create new neural associations. Other types of hypnotic techniques are Gestalt, parts therapy, age regression, past life regression, and even EFT, emotional freedom techniques. In my practice, I mainly use somnambulism and neuro-linguistic programming. I find that they are the most beneficial and patients are most receptive to them. For any of you who aren't familiar with neuro-linguistic programming, it is a very powerful technique in that it's based upon behavioral patterns that have been learned through experience or programming. A famous example of this is the example of classical conditioning displayed in the Pavlov's dog experiment. This is when Pavlov would ring a bell and give the dog meat, and eventually through training, the dog was conditioned to salivate regardless if the meat was there or not, but just by the stimulus of hearing the bell. So a stimulus becomes a conditioned response. And humans have stimulus response conditioning as well. But unlike dogs, we have a witness part of ourselves that is able to become aware of the stimulus response pattern. We have the ability to choose otherwise. So NLP really is powerful in creating a pattern disrupt to shift one's response. So that may, an example of that may be if somebody has the stimulus of getting stressed and their response is lighting up a cigarette, NLP can be very powerful in creating a disrupt pattern, meaning that instead of automatically thinking about lighting up a cigarette when you're stressed out, you may actually think about drinking a cup of water or going on a walk. And that's where the hypnotic technique comes into place in practice when the patient has a session. So moving on to acupuncture. I know that there are presenters here that practice acupuncture and traditional Chinese medicine. Amazing stuff, amazing work. I really appreciate, our entire field and how supportive it can be in so many different ways. So essentially, and so in that way, I apologize if this is redundant for you because you have a very deep understanding of acupuncture. But in general, acupuncture is based on regulating the flow of qi or energy in the body through the nervous system and blood vessels. These channels are known as meridians in Chinese medicine. So as you see those lines on the individual in the picture, there's all these different meridians that run throughout our body. And there's points located along these meridians that when activated with the needle, send signals to the brain, which have a cascading effect on the body. So for instance, if I were to do a treatment for relaxation, it triggers your brain to create more serotonin or dopamine, those feel-good neurotransmitters. Or another example is if I am treating a patient for pain, it stimulates the brain to increase opioids, the natural pain reliever, and assists in the flow of circulation and decreases inflammation, aiding in the healing process. So acupuncture is really based upon the premise of establishing homeostasis or balance in the body by activating the necessary points. So acupuncture is also performed not only on the body, but in the ear. And this is where I go into nada. This is a very specific protocol that is used a lot of times for addiction. And I use it many times in my practice because it is very powerful in treating conditions such as smoking cessation, alcohol abuse, or even weight loss. So NADA stands for the National Acupuncture Detoxification Association. The ear, as you can see on the picture, is a microsystem of the body. It has over 200 points that associate to different organs, hormones, functions, and glands. So the NADA protocol is a specific protocol that activates points in the ears that are associated with detoxification, decreasing cravings, and inducing relaxation. The NADA protocol is very well known, especially in the communities of addiction programs, the criminal justice program, and even trauma response. So the 5 points in NADA, as you see there on the ear, are the lung, Shenmen, autonomic point, liver, and kidney. So the lung point helps with issues of detoxing and, chronic cough, for instance, if you're treating smoking cessation. It's also associated with grief and sadness in Chinese medicine. Shedman is an amazing point, as I'm sure you all know. It really helps to release stress and anxiety. The autonomic point helps to relax the sympathetic nervous system, the fight or flight response, and as well as the parasympathetic nervous system. The liver helps with detoxification and even conditions such as hepatitis or cirrhosis. And the kidney point helps with detoxing and purifying the body. The kidneys in Chinese medicine are also associated with fear and willpower. So a lot of times, especially when patients are dealing with an addiction of sorts, they have a lot of strain, especially on their kidneys too, because the addiction, the substance, a lot of times can consume that qi. So supporting the kidneys, which is the battery of the body, is very important. So these 5 points are a powerful recipe in treating addictions. And those addictions can be anything from food, alcohol, to smoking. So in my practice, I combine acupuncture and hypnotherapy together to help treat all levels and layers of an individual: mental, emotional, physical, and spiritual. And so when I do both on a patient, what that looks like is I have them lay on my treatment table and I put in the acupuncture points. And while the acupuncture points are doing their work, I overlay it with the hypnotherapy. So I am doing it simultaneously. And that is very effective in treating many conditions, especially in addiction. Overall, the treatment is very relaxing. I always reinforce with new patients that I'm not going to make you quack like a duck or anything, you may have heard with hypnotherapy. Therapeutically, it's a very relaxing process, and most people just float right on out of the treatment room at the end. So, using NADA and hypnotherapy, as I said, it's really good for addictions. So essentially, when you put the needles into the ear, and of course, you can incorporate body points depending upon your treatment protocol. So for instance, with smoking, not only would I do the NADA protocol in the ear, but I would probably also do body points associated with the lung, with breathing, with cough support, and with overall healing grief and sadness, because that is on an emotional level something that many times I found smokers have a stagnation or a blockage with. So when I am treating smoking cessation, a lot of times I'll incorporate NLP to create negative neural associations. So once again, creating a new habit or pattern, but also a new connection with smoking. And I found that a lot of times when somebody is wanting to let go of an addiction such as alcohol or cigarettes, those are two things that you do not need to live life. You can literally just let them go, as opposed to food. Food could be a little bit more challenging in that you have to create healthier relationships with food because you need it clearly to survive. So with smoking cessation, I may incorporate a negative association, such as, thinking about licking the bottom of an ashtray or putting your lips around the exhaust pipe of a car. It may seem very extreme, but on a subconscious level, your brain really doesn't know the difference, and it can be very powerful in creating that adverse response. For weight loss, I also incorporate the NADA protocol because many times patients are addicted to specific types of food, most especially sugar, because sugar is very addicting. And with weight loss, I've found The most powerful technique is not only NLP, but also somnambulism, which is that positive reinforcement and association technique when a patient's very relaxed. And so with that, I'll kind of do a combination of some negative associations, let's say with sugar, and having a patient imagine that if you eat something sweet, like a donut, it's so sickly sweet, it's almost like eating raw sugar with syrup on top. So it's very sweet, and it can create that negative association or almost that aversion. And then you overlay it with a positive suggestion around healthy eating, choosing those foods that are colorful. If you have a sweet tooth, choosing wonderful, healthy fruits. And I'll also associate stimuluses and responses in attuning to your body, in knowing when you are in fact truly hungry, and stopping when you're satiated and satisfied. And of course, using visualization techniques as well, to imagine yourself healthy, vibrant, slimmer, things like that. The power of visualization can be very incredible. And overall, whenever I use the NADA protocol, I always incorporate ear seeds or magnets in the ear, which are on little pieces of medical tape that patients can use for reinforcement. So it's a really good way to have them have a cue in their ear for reinforcement when they feel like they need it. They can squeeze the different points, or even knowing that it's there, it can be a subconscious trigger reminding them of these changes that they're making. In my practice treating acupuncture, I'm also trained and specialized in 5-element acupuncture. And I'll go over what that is. So 5-element acupuncture is based upon the elements of nature. So in nature, we have fire, earth, metal, air, and wood. And with each of the elements, they're associated with different organs and functions and emotional, mental, and spiritual qualities within our body. So the whole premise is that we are a part of nature and nature is a part of us. So when you are a practitioner treating in the realm of the 5-element, you're really just shifting your lens to determine what elements are out of balance and do points according to them to bring them into balance. And I know that we have some other speakers today that will be talking on 5-element, which is great. So I'll just keep the synopsis short. But overall, since we do have a lot of the elements, some of them are more predominant than others. And so, for instance, if you have a lot of fire, you may be somebody that talks fast, that loves to engage with other people, that loves to be extroverted. As opposed to if you have a lot of water, you may be someone that is very relaxed, easygoing, talks slower, things like that. So the water element, for instance, is associated with the kidneys and the urinary bladder, the waterways of the body. When that manifests as being out of balance, that may manifest physically as kidney stones or urinary tract infections and things like that. On an emotional level, it may manifest as feeling stuck or stagnant or not having the willpower and flow to move forward in life. So integrating 5-element acupuncture with hypnotherapy in treating patients for those conditions we went over before, such as weight loss, insomnia, motivation, confidence, it can be very powerful. And now I'm going to discuss to you a little bit more about the 5 elements and their associations. So the wood element is associated with the liver and the gallbladder. two of the main organs that help to detox the body. It's also associated with self-esteem, vision, and structure. Wood can also be associated with clarity, and when out of balance emotionally, it may manifest as anger or resentment. The earth element is associated with the spleen and the stomach. It has to do with nourishment and assimilation and digestion. And not only is that on a physical level, but also on an emotional and mental level. So if you're stuck in a pattern of worry, it's almost like a spinning earth. Fire is associated with the organs of the pericardium, the heart, the small intestine, and the Sanjiao. Fire is connected with communication, connection, inspiration, action, and when it's out of balance, it may manifest as a lack of joy, or you may feel like, your heart is shut down, or a patient may feel isolated. That could represent a lack of fire. The metal associates with the lungs and the colon. What is value and worth? Letting go, excretion, and when it's out of balance, it may manifest as grief or sadness, or a difficulty in letting go, which makes sense emotionally and physically, because the colon is all about excreting the waste from our body. So on a physical level, that may manifest as constipation, but emotionally, that can also reveal that someone, if they have constipation, have a hard time in letting go of some things emotionally, mentally, or even spiritually. The water element, as I just said, is associated with the kidney and the bladder, is associated with flow, faith, resources, and fear versus willpower or faith. Okay, great. I just wanted to share a couple of case studies. One of my case studies is a patient by the name of Joan, and she came to me because she had difficulties with being obese and being overweight and emotional eating, and she was recently diagnosed with diabetes. So she was really trying to focus on helping to heal herself and to turn things around more naturally than just taking medication. So when I saw her, I did a thorough intake, and I definitely recognized that her earth element was out of balance, meaning that she was nourishing herself improperly, eating when she wasn't truly hungry and eating poor junk food. So those were points in the body that I focused on, but also in Chinese medicine, there are points that are associated with metabolism and digestion and things like that. So, stomach 36, one of the main points for the stomach and digestion. Ren 12, one of the most centering and calming points. And it's also the front loo of the stomach, as well as spleen 3, kidney 3, and liver 3. I always like to incorporate the major yin organs for rooting what it is that we're working on. So for this patient, I also incorporated the NADA protocol in the ear. She did have a sweet tooth, and then I overlaid it with hypnotherapy. And for her, as I mentioned before, I used the NLP technique in creating an aversion or negative association with something that's too sickly sweet, such as donuts and pastries. She had an issue with those. And then I also established her cultivating a healthier relationship with food, eating when she's truly hungry, stopping when you're satiated and satisfied, and things like that. So over the course of about 6 treatments, she was able to lose a good amount of weight and begin to anchor into these new habits and patterns. So especially when you're working with hypnotherapy and creating new habits and patterns, they're not created overnight. So you can't expect them to shift overnight, although sometimes they can. So for her, really helping her anchor into attuning to her body and knowing what she needed for nourishment was very important. So over the course of those sessions, she did cultivate a greater relationship with herself and with food. She lost weight and her glucose levels went down, which was amazing. So she's on a great path right now. And she was able to give up donuts and Dr. Peppers. So that's pretty incredible. Okay, and then another case study I wanted to share was a gentleman who came to me for flight phobia. He had a very large fear of flying, and it got so bad that he didn't fly for 15 years. And he came to me and he was very distraught, and he heard that hypnosis, can help shift someone's frame of mind when it came to flying and get over it, any fears. So when I treated him, I also incorporated acupuncture, and I did do some of the points in the ear associated with the sympathetic nervous system, that fight or flight response. So when I was working with him, I activated the points in his ear and in his body to relax his entire nervous system, to feel calm, to feel anchored and rooted and at peace. And that was very important for recreating a new template or foundation for his nervous system. And through the course of, probably about 6 or 7 sessions, he was able to get completely over his flight phobia, and he was able to travel again. And so it's very incredible. I'm so happy for him. And, as far as the hypnotherapy, I really just reinforce on a subconscious level that it is one of the safest ways of transportation. He's safe. I incorporated different mental associations and techniques for him to relax. If he felt like he started to get nervous, to instantly become aware of it, take some deep breaths, squeeze the points in his ears that are associated with the sympathetic nervous system. So there's all these different components that you can incorporate with your patients that can be very effective for fears, phobias, addictions, issues such as, insomnia and things like that. Thank you so much for your time. I really appreciate you tuning in. If you'd like to reach out to me, this is my information. Please feel free to do so. I really appreciate the opportunity. Thank you so much.